Qualitative research and quantitative research. Identifying the problem and purpose in quantitative and qualitative studies. Quantitative and qualitative research approaches enable nurses to investigate a variety of research problems and purposes. What is quantitative research? Quantitative research is a formal, objective, systematic process in which numerical data are used to obtain information about the world. Understanding Nursing Research, ed. 7th, page number 35. What is qualitative researcher? Qualitative research is a systematic subjective approach used to describe life experiences and situations and give them meaning. Understanding Nursing Research, ed. 7th, page number 35. Problems and purposes in types of quantitative studies. Example research problems and purposes for the different types of quantitative research: descriptive, correlational, quasi-experimental, and experimental. Quantitative research topics, problems, and purposes. Descriptive research. Title of study: Hand hygiene opportunities in pediatric extended care facilities. Problem: the population in pediatric ECFs is increasingly complex, and such children are at high risk of healthcare-associated infections, HIEs, which are associated with increased morbidity, mortality, resources use, and cost. Problem significance: the Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO, 2009, have published evidence-based guidelines confirming the causal relationship between poor infection control practices, particularly hand hygiene, HH, and increased risk of HIEs. Problem background. However, most of the HH research has been focused in adult long-term care facilities and acute care settings, and findings from such studies are unlikely to be applicable to HH in pediatric ECFs given the different care patterns, including the relative distribution of different devices. Problem statement. Purpose. The purpose of this observational study was to assess the frequency and type of HH opportunities initiated by clinical, for example, physicians and nurses, and non-clinical, for example, parents and teachers, caregivers, as well as evaluate HH adherence using the WHO's 5 Moments for HH observation tool. Correlational research. Title of study: Emergency Department, ed. Weekend presentation and mortality in patients with acute myocardial infarction, AMI. Problem: each year in EDS across the United States, 8 million people are evaluated for symptoms that are consistent with AMI, and approximately 400,000 people die. Problem significance: patients who present to the ED with an AMI require immediate interventions and treatments to increase their chances of survival. The recommended guidelines, according to the American Heart Association and the American College of Cardiology for the management of a patient with AMI, includes diagnostic 12-lead electrocardiogram and biochemical markers, administration of aspirin, thrombolytic therapy within 30 minutes of arrival, and/or percutaneous coronary interventions, PCIs, within 90 minutes of arrival. Problem background: few research teams have specifically examined patient mortality for the patient with AMI in the ED and for those presenting to the ED on weekends and holidays. Problem statement. Purpose of this study was to determine if a weekend and holiday presentation is associated with an increase in mortality among patients with AMI presenting to the ED in New Jersey. Quasi-experimental research. Title of study: Methods and design of a 10-week multi-component family meals intervention, a 2-group quasi-experimental effectiveness trial. Problem: there is an ongoing childhood obesity public health crisis. Problem significance: American Academy of Pediatrics recommends participation in family meals as a childhood obesity prevention strategy due to the literature demonstrating a protective effect on participation in healthy mealtime routines on child and weight. Problem background. In addition, the majority of current research fails to examine the child health impact of family meals beyond BMI, body mass index. Future research. Specifically intervention work, would also benefit from expansion of the target age range to include younger children, 4-7-year-olds, who are laying the foundation of their eating patterns and are capable of participating in family meal preparations. Problem statement. Purpose. The purpose of this study was to determine the effectiveness of a 10-week multi-component family meals intervention aimed at eliciting positive changes in child diet and weight status. Experimental research. Title of study: Effects of oral care with glutamine in preventing ventilator-associated pneumonia in neurosurgical intensive care unit patients. Problem: Ventilator-associated pneumonia, VAP, is one of the most frequent nosocomial infections in intensive care unit patients. Problem significance. One of the measures to prevent the development of VAP is applying good oral care. In recent studies, glutamine was reported to be an essential amino acid that is critical for the regulation of protein synthesis, respiratory fueling, and nitrogen shuttling. Problem background. Different products and protocols in oral care has been the subject for research. However, the number of studies about glutamine is limited. Problem statement. Purpose. The purpose of this study was to determine the effects of oral care with glutamine in preventing ventilator-associated pneumonia in patients admitted to neurosurgical intensive care unit. Why we conducted quantitative studies. A descriptive study is conducted to identify the HH opportunities and adherence among clinical and non-clinical caregivers in extended pediatric care facilities. The purpose of correlational research is to examine the type, positive or negative, and strength of relationships or associations among variables. Why we conducted quantitative studies. Quasi-experimental studies are conducted to determine the effect of a treatment or independent variable on designated dependent or outcome variables. Experimental studies are conducted in highly controlled settings using a structured design to determine the effect of one or more independent variables on one or more dependent variables. Problems and purposes in types of qualitative studies. The problems formulated for qualitative research identify areas of concern that require investigation to gain new insights, expand understanding, and improve comprehension of the whole. Qualitative research topics, problems, and purposes. Phenomenological research. Title of study: Severe Childhood Autism, the Family Lived Experience. Problem: Autism is the most prevalent developmental disability in the United States, affecting approximately 1 in 68 children. Center for Disease Control, CDC, 2014. Approximately 1/3 of the children with autism are considered to have severe autism with significant functional challenges. Problem significance. There has been an effort to clarify autism severity based on a more holistic approach that focuses on the child's daily needs within the context of the family instead of solely on symptoms. Problem background. In many of these studies, however, the severity of the child with autism is not identified. Additionally, many of the phenomenological studies rely on the response of one family member, usually the mother, to portray the family experience. Extended family members or others considered as family have not been included in the studies reviewed. Purpose. The aim or purpose of this research was to interpret the meaning of the lived experience of families who live with a child who has severe autism. Grounded theory research. Title of study: A grounded theory study of how nurses integrate pregnancy and full-time employment, becoming someone different. Problem: According to the U.S. Department of Labor, there are approximately 1.7 million nurses in the United States, 40% of whom are women within the childbearing ages of 20-45 years, and more than 65% are employed full-time. Problem significance. Research from 1990 to 2000 reported mostly unfavorable findings. Related significance. Research from 1990 to 2000 reported mostly unfavorable findings related to attitudes surrounding pregnant employees in the workplace. Some employers, conversely, embrace their pregnant employees and view them as valuable members of their work teams. Problem background. Nursing, as an international industry, has not explored how its female workforce, that is, nurses, integrates pregnancy and employment. Problem statement. Purpose. The purpose of this research was to explore how primiparous U.S. nurses integrated pregnancy and full-time employment. Exploratory descriptive qualitative research. Title of study: Women's Perceptions of Biases and Barriers in Their Myocardial Infarction Triage Experience. Problem: every 10 minutes a woman dies from a myocardial infarction (ML). Yet, symptoms of impending ML in women are less likely to be recognized than in men. Problem significance: investigators have examined the cardiac triage decisions of ED nurses, who are often the first healthcare provider to evaluate and triage women for ML and initiate guideline recommendations. Results indicated that nurses do not always recognize women's cardiac symptoms and their practice does not consistently adhere to ML evidence-based guidelines. Problem background: less is known about the personal experiences of women within the ED healthcare system that may affect the accuracy or timeliness of nurses' cardiac triage decisions. Problem statement. Purpose: therefore, the purpose of this study was to examine the cardiac triage experiences of women who presented to the ED with an acute ML. Ethnographic research. Title of study: Perceptions and Experiences of Using a Nipple Shield Among Parents and Staff, an Ethnographic Study in Neonatal Units. Problem: breast milk mediates unequaled beneficial effects regarding nutritional, immunological, and cognitive outcomes in preterm infants, 37 gestational weeks, GW. Therefore, international recommendations state that infants should be exclusively breastfed for the first 6 months of life. Problem significance: although research shows that preterm infants display rooting, efficient areolar grasp, and repeated short sucking bursts from 29 weeks, and occasional long sucking bursts and repeated swallowing from 31 weeks, the transition from tube feeding to exclusive breastfeeding at the breast takes time. Problem background: however, the use of nipple shields is very controversial and study results are contradictory. Furthermore, no study has previously explored the parents' and staff's perspective and experiences of using a nipple shield in neonatal units. Problem statement. Purpose: the purpose of this ethnographic study is to explore perceptions and experiences of using a nipple shield among parents and staff in neonatal units. Why we conducted qualitative studies. Phenomenological research is conducted to promote a deeper understanding of complex human experiences as they have been lived by the study participants. In grounded theory research, the problem identifies the area of concern, and the purpose indicates the focus of the theory to be developed to account for a pattern of behavior of those involved in the study. Exploratory descriptive qualitative research is being conducted by several researchers to describe unique concepts, issues, health problems, or situations that lack clear description or definition. In ethnographic research, the problem and purpose identify the culture and specific attributes of the culture that are to be examined, described, analyzed, and interpreted to reveal the social actions, beliefs, values, and norms of the culture. References: Understanding Nursing Research, ed. 7th, page #35, 167-169. www.physiopedia.com web link. www.invspcro.com web link. www.wallstreetmojo.com web link.